Calls tonight for more safety measures in emergency rooms. Good evening. Thanks for joining us. It comes after a nurse was allegedly assaulted by a patient who was frustrated over the long wait. Standing by live with the fallout tonight is CTV's Danton Unger. So Danton, what exactly happened here?
Well, Marilee, the Nurses Union says a patient assaulted a nurse and then was allegedly fast-tracked by management in order to be discharged sooner. Now, Manitoba's health minister has denied this, saying no aggressive patients are being fast-tracked. And all this comes as the province is reporting some of the highest wait times it's seen in more than a year, which the union believes is leading to more violence.
The union representing nurses in Manitoba says the assault happened here at the Grace Hospital Emergency Department on March 26th. A patient upset with the long wait, allegedly assaulting a nurse.
The nurse was very upset, but what was even more upsetting was that they were then directed to fast-track the patient through the department to have them seen and discharged.
Manitoba Nurses Union President Darlene Jackson says fast-tracking a patient sends the wrong message.
It sends a message that it's okay to punch a nurse because you just get to be seen quicker.
The Winnipeg Regional Health Authority says security restrained the patient after the attack and Winnipeg police were called. It says there's a balancing act to address staff safety while fulfilling the ethical and legal duty to provide care to patients. Telling CTV News in a statement, a process is being used to ensure some patients who are known to have aggressive behavior are provided care in a way that limits the amount of time they'll spend in our facilities while still receiving the appropriate level of care for their medical needs.
No, folks who are harming staff are not being fast-tracked for care, but there are protocols that have been developed to make sure that patients and staff are safe and secure.
Manitoba's health minister wouldn't elaborate on what these protocols are specifically, citing privacy concerns.
What I can say is that the protocols make clear that if there's a safety or security threat identified, that there are steps taken to address that, to make sure that people are able to provide care and receive care safely.
A lot of the violence is related to the wait times.
This comes as the WRHA is reporting the highest ER and urgent care wait times it's seen since December 2023. In February, patients were waiting nearly 4 hours, up from 3.58 hours the same time last year.
We did see a bump in February that correlated with flu season.
Mr. Azaguera says the province is adding more nurses, beds, and reopening the Victoria ER.
Our government is doing the work to bring those wait times down and to trend those down in the weeks and months to come.
In terms of safety, the health minister says the province has more than 100 institutional safety officers in hospitals and plans to add dozens more, but wouldn't say when exactly we will see these new officers hit the ground. The union says there are currently no safety officers at the Grace Hospital. We asked the minister about this, and they say the province is assessing the safety and security needs there and will be taking steps to address them.
Dan, what about this assault? Was an arrest made?
Yes, Marilee, police confirmed officers responded to the incident and a woman is now facing one charge of assault.